Antigen rapid diagnostic testing can be deployed as a reactive surveillance intervention, in which populations are screened for COVID-19 in response to a suspected surge in outbreak risk. In this work, we used an individual-based model to simulate SARS-CoV-2 transmission in a long-term care hospital in the context of a surge in local outbreak risk, and estimated the efficacy and efficiency of reactive antigen screening. We ran our simulations across a range of COVID-19 control scenarios, reflecting varying use of common control measures like vaccination. Surveillance interventions were simulated retrospectively through counterfactual analysis by pruning transmission chains downstream from individuals who test positive. Through this, we estimated efficacy of surveillance interventions for transmission prevention in the top right. While routine PCR testing for symptomatic cases prevented up to 47% of infections, a combined strategy of reactive antigen screening in addition to routine PCR testing prevented up to 64% of infections. Lastly, a strategy of conducting 2 consecutive rounds of reactive antigen screening, in addition to routine PCR testing, prevented up to 75% of infections. This strategy was most effective given a lag of 4 to 5 days between the 2 rounds of screening. The bottom right figure shows the cost effectiveness of this latter strategy. It was highly cost effective in the low control facility, costing approximately €750 per infection prevented, given standard testing costs in France, but was significantly less cost effective in the high control facility, costing closer to €20,000 per infection prevented. Overall, reactive antigen screening was found to complement routine PCR testing, but decision makers should carefully evaluate their vulnerability to SARS-CoV-2 outbreaks and hence potential returns on investment before implementing reactive antigen screening interventions.